New tonight at 10, rural hospitals are set to be getting a bump in funding if they are eligible for it. Governor Greg Abbott announced up to $17 million in grant funding to eligible hospitals across Texas. News West 9's Jason Freund talked with a rural hospital organization who provided some more insight into how this bill will help out these hospitals. Jason, what can these hospitals get from this bill, especially here locally?
Alex, the Rural Hospital Financial Stabilization Grant will give qualifying hospitals $100,000 to $375,000 over the span of 2 years, which could be used for a range of needs like repaying debts, making facility repairs, or buying or renting new equipment. According to the Texas Health and Human Services, the money for the grant is part of a $50 million investment in rural hospitals by the state.
It's just a budgeted appropriation by the legislature. Thankfully, Texas has budget surplus and availability of funds, and they just made rural health and access to care in rural communities a priority.
This fixation on rural hospitals comes at a time where many are closing their doors, leaving their patients in the cold.
And we actually count 26 rural hospital closures in Texas since 2010. That's more than any other state. They have challenges with regard to demographics and a population that's poor, which is Medicaid, older, which is Medicare, less insured than suburban areas or urban areas of the state.
And with small town hospitals not having the ability to spend as much as their big city brethren, a little bit of extra cash in the wallet could go a long ways.
And then you combine that with, no real leverage in terms of purchasing power or contracting, and not the same volumes as urban hospitals. So rural hospitals are the endangered species in Texas.
But there's a laundry list of qualifications, though. In order to qualify for the grant, a hospital must not be part of the REH Financial Stabilization Grant, have a current and active license, be the sole licensed general hospital or provider in the county, meet certain financial indicators, be classified by the Texas Administrative Code, have no active vendor holds or pending disciplinary actions, agree to monthly monitoring, and submit a complete application with a 2-year financial plan. There's also the amount of beds one is licensed for. The number is 25 or fewer.
It's how many beds you're licensed for. If you're under that threshold, you can apply and you will receive something. And it's a non-competitive grant, so it's not like some get it and others don't. It's just a matter of how you score out on some of the financial metrics, whether you receive the low, medium, or high amount.
And while some of the larger rural hospitals may not meet these qualifications, Henderson predicts that out in West Texas, those rural hospitals can get a doctor's note for more funding.
There are some larger rural hospitals around Austin and San Antonio and out in East Texas that actually won't qualify for the funding. But the rural hospitals in West Texas generally are under that bed threshold, so they'll all qualify and have access to those funds.
And we have called some of the hospitals out there in counties such as Reagan, Martin, and Wink about this, and they told us that they were still looking into whether or not they would apply for the grant. The last day that rural hospitals can apply for this is Friday, June 21st.